First time we met was in a church. The young lady came and sat on the end of my row, and I just looked at her and I thought, wow. Within 18 months, I think we were together.
So what year was that?
1966, March the 5th.
Look at you both there.
We've been married 59 years in March.
Sheila and Paul Banbury are inseparable, their years together full of memories. But after Sheila was diagnosed with Alzheimer's in 2018, Paul has relied on outside help to prevent his wife from going into a care home.
Hello.
You had enough?
Yeah.
Yeah?
She's been quite good, actually. That's how happy as she's been today. She's laughing now.
The carers who come into their home do the things that Paul can no longer do.
I think they're amazing.
I was going to say the prospect of being split up. Take me through what how that would feel.
It would be very difficult after such a long time together.
But care providers say services like this one that Paul and Sheila rely on are under enormous threat. That's because they say costs for these services are rising faster than the money they receive for them.
We will increase the rate of employers' national insurance by 1.2 percentage points to 15% from April 2025.
When the Chancellor of the Exchequer announced that businesses would have to pay more in national insurance for each person they employ, it caused outrage amongst many businesses, including care providers. According to the Nuffield Trust, the rise in national insurance will cost the adult social care sector an extra £900 million a year. Add in the rise to the national minimum wage and those additional costs rise to an estimated £2.8 billion.
So this is our domain, this is Applewood Support.
Jane Jones runs the company that provides care to Sheila and Paul. She's been in the industry for decades.
When you first heard the Chancellor say she was increasing national insurance contributions for employers, what was your first reaction?
I felt sick, physically sick. It worked out to be about £6,000 a month extra that I would need to find. We've got rid of 2 personnel in the office because we just can't afford it. It's soul destroying.
You know, the whole reasoning behind the Chancellor's budget was to encourage economic growth. It's her #1 thing. But from what you're saying, it appears that it's had the opposite effect.
It's the complete opposite effect. It's an attack on our growth because we can't grow. We can't employ any more staff because we can't afford the NI. We cannot increase our costs like the supermarket can. We are limited to what the government councils can pay us. So if they can't pay us the right amount of money, we're just going to go close our doors. I'm sure that's going to happen in come April.
The government says it's putting an extra £600 million into social care. But providers say increases to national insurance and the national living wage will wipe that out as social care lurches from crisis to crisis. Nick Martin, Sky News.